Hello, my name is Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. Welcome to our video seminar series. Hope you enjoy this video. So this video is on cognitive behavioral therapy, also known as CBT, which is a common treatment modality that's used to treat many different psychological disorders. So let's discuss a little bit more about CBT. In a nutshell, CBT is symptom-focused, which means in CBT, we really try to figure out what exactly your symptoms are, and we want to address those symptoms directly. Skills-focused, which means that a large part of CBT is giving you the skills to then deal with whatever symptoms you are experiencing. So it's not so much that the therapy itself or the therapy relationship is what's the driving factor here. It's more about the skills that are discussed and talked and implemented and practiced in the therapy room. It's time limited, which means the goal is for you to eventually get out of therapy, not to stay there for life. It's evidence-based, which means that they've run many RCT, random controlled trials, and have found these therapies that fall under this umbrella called CBT to be effective. Most of the work in CBT therapy is done between sessions, not in the session. So this is what I was alluding to before, where you're going to learn about a lot of skills in the session, implement it and practice it in the session, but ultimately the main treatment outcomes, the main impact that CBT has comes from how much work is done between sessions. So after each session, we assign an action plan for the week. We try implementing the skills. You test them out. You see how it goes. You practice more. We review them again next session. But it's a very active treatment between sessions. And ultimately, the goal is for you to become your own therapist so that once you have all the skills, you have your toolbox ready to go, you then can sit down with yourself and say, okay, what symptoms am I experiencing and how am I going to apply these CBT skills to my current situation? In fact, during my termination session with patients, where we discuss relapse prevention, one of the main things that I make sure to discuss is how important it is for them to keep going to therapy just without a therapist. So let them reserve the same time that they were going to be in therapy with me for themselves, and let them do a weekly check-in with themselves, see where they're at, what they may be dealing with, and how can they then use all the skills they've gained in therapy for the rest of their lives. So let's discuss the CBT Basic Conceptualization. The basic idea is this: what you think and do affects the way you feel. If you think about it, CBT, cognitive, refers to the thinking aspect, behavioral refers to the doing aspect, and then ultimately those things affect the way you feel. But it's not so simple, because we have our thoughts, we have our behaviors, you have emotions, right? So it is true that what you think and do affects the way you feel. We also have bodily sensations, which are kind of the physiological responses within our body. So for example, increased heartbeat, or if you're maybe sweating or feel shaky or feel weak or feel tired. So you have that component as well, not to forget about. But also, as you can see here with all the arrows, each domain affects other domains in bidirectional relationships, so that it's not only that your thoughts affect your behavior, which affects the way you feel, it's also that the way you feel affects the type of thoughts you have. The way you feel affects the behaviors you engage in. Bodily sensations also affect ultimately how you feel. So let's just take a very simple example of maybe someone who's very depressed. So they're probably having thoughts like, what's the point of life? Nothing's going well. My situation's hopeless. And so that's going to likely cause a behavior of staying in bed. And what happens if you're thinking really negatively and you're behaving really, if you're just staying in bed, you're not really active, then chances are it's going to then exacerbate how depressed you've already started feeling. And when you're more depressed, you're likely to have more depressing thoughts. And your bodily sensations might be very lethargic or feel like you're like almost paralyzed in bed. And when you're feeling that way physically, then of course your emotions are going to come in line as well, and your behaviors are going to want to stay in bed. So as you can see here, it's a bit convoluted, but if you take your time with this, you'll notice that each of these domains affects the other domain in such a way that it becomes a complex web of cyclical relationships between these different domains exacerbating your situation. So let's discuss some specific CBT skills. There are cognitive skills, which we'll talk about in a moment. There are behavioral skills, and then there are physiological targeted skills. Now, the different skills that you'll be using within each of these domains depends on the disorder that you are experiencing. So a behavioral skill for social anxiety might look different than a behavioral skill for depression, and soon I'll talk more about this. But very broadly speaking, some examples of cognitive skills which are very common include thought records, which involves self-monitoring, and I'll talk more about that soon. Cognitive restructuring, kind of changing the way you're thinking. I'll talk about that soon as well. Behavioral skills will be behavior activation, getting up and active and engaging behaviorally in your life. Exposures falls into this category as well. And for physiological skills, simple things such as deep breathing can calm your body down and make your body feel a little bit more balanced. And progressive muscle relaxation is another one of those, that another skill that can help with relaxing your body when you're feeling physiologically aroused. So let's get into more details of all these different types of skills. For cognitive skills, we mentioned thought records. So a basic thought record looks something like this. This is the most basic form you can get, right? There are more complex ones that add more components. But in short, one of the main goals of thought records is just for you to start recognizing how much your thoughts play a role in your life. So you have to start recognizing, like, what actually am I thinking? Many people feel like I don't have any thoughts, I just feel horrible. But usually, if you are brain dead, you're not going to feel horrible, because you need to have, usually, for the most part, it's thoughts that are really affecting how you feel, at least in this CBT framework. And so thought record allows you to record a situation, for example. So a situation maybe where you're feeling really depressed. So you write down what happened. Then you have to start thinking, well, what were my automatic thoughts? So maybe the situation was you said good morning to a coworker and they didn't respond to you. And your automatic thoughts were that they're upset with you, that they think they're better than you, that they don't like you. And then how did it make you feel? Well, you felt anxious, you felt sad, you felt hopeless maybe. So this skill helps you first get into your head, so to speak, and figure out, well, what exactly is going on. Instead of saying I feel horrible all the time, what thoughts accompany that? Because the first step to being able to eventually change your thoughts is being able to identify them. Next comes cognitive restructuring, which starts with identifying cognitive distortions. So cognitive distortions are patterns of thinking that are distorted. They don't reflect reality as it is. So let's take one example out of these six, although there are obviously more than these six. All or nothing thinking. So it's also called black and white thinking. If I'm not perfect, I've failed. Either I do it right or not at all. Either my day went horribly or it was amazing. Either my coworker really likes me or they hate me. So you see how it's very dichotomous? It's very black and white. It's yes, no. So that's a very common distortion that we find. And then there are a bunch of other ones here. Overgeneralizing, so seeing a pattern based on just one event. So for example, if maybe you failed one test and you go home and you tell your parents, I'm failing all my classes. In reality, no, you just failed one. So it's kind of overgeneralizing from one event to more events. Mental filter is where we're only paying attention to evidence that corroborates our negative self-beliefs. And so, for example, you are only noticing the coworkers that are not interested in you, but you're not noticing the coworkers that are responding to you. Disqualifying the positive refers to when you have something positive. So maybe even you yourself recognize, well, yeah, it is true that some of my coworkers are responding to me, so I'm not hated by everyone. But you immediately disqualify it and say, yeah, they don't really mean it. They're just being nice to me. They just feel bad for me. Jumping to conclusions is one that's very common in social anxiety, especially. also in depression and other disorders, but it can involve mind reading, where you think you know what other people are thinking. So I know that they don't like me, or fortune telling. I can predict, like I'm for sure failing this class. Magnification or catastrophizing, or minimization is where we're blowing things out of proportion. So something's kind of bad, but then in your mind it's like the worst thing in the world. So this is just some examples of cognitive distortions. But when someone is depressed or really anxious, usually a lot of these are very, very hard, heavy, are very much in play, I should say. And so that's another cognitive skill, being able to identify, well, how am I thinking and what patterns am I noticing here? What distortions perhaps am I experiencing here? Now, once you're armed with all that knowledge, then you can go on to cognitive restructuring. So cognitive restructuring, again, this is the most basic form of cognitive restructuring. It's where you're writing down your automatic thought. So everyone hates me. And then maybe you figure out, wait a second, what are some distortions in that thought? Well, some people told me they like me. I do have friends. They ask me to hang out, right? So all this is some evidence against that thought, right? But what distortions I guess, experiencing here? Well, all or nothing thinking, like everyone hates me. Mind reading, as if I know exactly what they're thinking about me. And so you can document from the previous slide some of those distortions into this cognitive restructuring form. And then you want to come with a more rational response. So what would be a more rational response? And that might be, lots of people like me. This coworker ignored me this morning. It could be it's because they don't like me. And it could be for many other reasons, such as they didn't notice me. They were like stressed out themselves. They responded and I just didn't realize that they responded because it was like a really quick response. And so, again, this is a very basic form of cognitive restructuring, but ultimately when you go through this process, you end up feeling better, less, your emotions become less intense, and you can see reality a little bit more for what it is. So let's get into some behavioral skills now. So one example of behavioral skill would be behavior activation, which we use in depression. Behavior activation is similar to the Nike slogan of just do it. Behavior activation refers to getting up and active. And the idea behind this skill is that when we're depressed, the last thing we want to do is get up and be active. But not being active is not just a result of depression, it can also cause, or it can keep alive the depression. Because if you're in bed all day, you don't have any chance to experience life or get any positive feedback from your environment, so you just stay in bed and get more depressed. So behavior activation can be really doing anything. Like I have here on the screen a bunch of different categories. It could be animal related. You could like walk your dog, pet an animal. You can cook. You can use your mind for different things. Engage in self-care, shopping, music, being active, cleaning, being involved with nature, trying something new, traveling. It can be anything as long as you're getting active. Now, we do try to look for one of two things when it comes to behavior activation. We try looking for activities that you find fun or pleasurable, and we also look for activities that you find meaningful, because those two things usually are going to be give you that extra boost. But this is just an example of how, one of the behavioral skills that we might use in treating depression. Another behavioral skill I mentioned before is exposure. That looks like a really scary dog. So when it comes to exposure is this idea, usually for anxiety disorders, where someone is really anxious. It could be anxious of a dog, like in specific phobia. It could be an OCD, and you can check out my videos on OCD where I discuss OCD, different OCD subtypes and how exposure is used there. Over there it's called ERP, exposure and response prevention. But when it comes to exposure, the idea is if you're really afraid of something, in order to get over the fear, you have to expose yourself to the fear. Now, you don't have to engage in what's called flooding, where you are exposing yourself to the highest level of your fear. But if you're really afraid of dogs, you can start by just looking at pictures of dogs, right? And the more you do it, the less afraid you're going to become. And you can go up your hierarchy where you get more and more, like closer and closer to your feared stimulus. Other examples of exposures might be related to social anxiety disorder, where if someone is really afraid of being evaluated negatively by other people or making a fool out of themselves, so you can, purposely say a comment that may not get the best attention out of people, or you may purposely, if you're at the gym, stay on one of the machines a little bit longer even though you know someone is waiting for you. So again, you can engage in these exposures where you are slowly confronting your fear, and this would be another behavioral skill in CBT. When it comes to physiological skills, I mentioned deep breathing before. So in deep breathing, someone just kind of slows themselves down and relaxes themselves by taking like deep breaths and exhaling really slowly. That's really the key. Inhaling doesn't really matter that much, but exhaling really slowly does matter. So what I normally tell people is something like inhale for about 5 seconds, maybe, hold it for about 2 seconds or so, and then exhale for a good 10 seconds, 12 seconds. You'll be surprised how slow you can slow it down. And many times people say that they've tried deep breathing and it's just annoying and doesn't really help them. And I was one of those people. So I know my heart goes out there. I know exactly what you feel. But when I slowed it down to the levels that I'm describing now, I did notice a very powerful immediate impact. So if you're one of those people, I recommend you give it another chance and just try to really slow it down, like 5 in, hold for 2, out for 10 or 12. And as you're breathing out, you can think about the word relax. You can think about a nice, relaxing scene. But you'll be surprised just a few of those breaths can calm your body down when you're feeling anxious. I also mentioned progressive muscle relaxation on the initial slide here. And progressive muscle relaxation is just where you go through your body muscle group by muscle group, one muscle group at a time, where you kind of tense up and then release the tension from those areas. And there are a lot of YouTube videos on this if you're interested in looking into more detail. It's called PMR, progressive muscle relaxation. But these are some skills that we use to calm the physiological body down. Whereas the cognitive skills and behavioral skills are more for your thoughts and your emotions. So let's discuss case examples briefly from a CBT perspective, although I've already mentioned some. We can take one common case of depression. So when it comes to depression, we would want to identify the cognitive distortions. Well, we first want to record what are these automatic negative thoughts you're having. We want to identify some of the distortions. We want to see the validity of the thoughts, evidence for, evidence against, come up with new thoughts that are more rational, and ultimately you will then feel less depressed. That would be the cognitive skills. And then the behavioral skills mostly would be behavior activation, getting up and doing things even if you're not interested in it. Sometimes what we do is we have people record, like predict how much fun or how meaningful they think the activity will be and how hard it is to do it. And they usually record like, it's not going to be any fun. I have no interest in this, which is due to what's called anhedonia, a loss of interest or pleasure in things that you used to enjoy doing, and that it's going to take like a lot of effort to do. And then they re-record it after the fact, and usually after the fact they say, you know what, that actually was more enjoyable than I predicted, and it was less difficult than I predicted. So when it comes to depression, those are some examples of cognitive skills and behavioral skills that we would apply to this disorder. One more example of social anxiety disorder. And again, here, what are some of those automatic thoughts? And what are the distortions? And what are more rational thoughts? So some of those automatic thoughts might be that everyone at the gym is looking at me, or when I walk into a room late, everyone notices me and thinks like I'm terrible for coming late. And so we look at some of the distortions there. A common one, like I mentioned before, is jumping to conclusions or mind reading. Also, all or nothing thinking, could be overgeneralizing, mental filter. There are so many cognitive distortions that could be at play. And then we come with a more rational thought of how most people at the gym are focused on themselves, looking in the mirror and seeing how they're doing, or they themselves are nervous about other people looking at them, or they do notice you and think like, okay, that's strange, and then they move on with their day and they don't have another thought about you. But in your mind, it's like this really big deal. So when you realize that, you can start feeling better about it. And then some exposures might be, like I mentioned before, purposely come a few minutes late into a room and realize that anxiety is just a feeling in your body that you could get past, that you don't have to be afraid of. And the more you would do that, or another exposure can be like calling up some kind of customer service line and asking for help, or asking them a question. It could really be anything that kind of puts you out there. Things that you were afraid of doing, you just got to start doing it. But do it slowly, consistently, again and again, and then ultimately becomes easier. So in short, CBT is symptom focused, skills focused, time limited, evidence based, and the goal is for you to become your own therapist. which means that there's a lot of work done between sessions, not just in the session. CBT incorporates both cognitive and behavioral skills that vary based on the disorder. So a behavioral skill for depression might look different than a behavioral skill for anxiety, for example. And like I mentioned before, the goal is for you to become your own therapist. So I just want to mention that this was a very, very basic primer video on CBT, just to get you, just to describe the very basics of this form of treatment. And if you're interested in learning more about CBT or about other conditions, I recommend you check out other videos that we'll be posting where we go more in depth in these different treatment modalities and also applying them to different conditions. Hope you enjoyed this video seminar. To see a full list of our current videos as well as upcoming videos that we'll be posting soon, visit us at adopsychologycenter.com and sign up to be notified when we post new videos. Bye for now.